Welcome back. Let's get you now some updates coming in from the state of Karnataka, which has witnessed a spike in the number of cases in the last 4 days, which has raised some serious concerns. Now, the recovery rate on Monday stood at 25.2%, which remains another worry because Karnataka is currently lagging behind on the recovery rate as compared to its neighboring states like Tamil Nadu and Kerala. Meanwhile, speaking to Mirror Now, the nodal officer in charge of the state's COVID-19 war room said that the state is also likely to see a spurt in the cases right after the lockdown period as well. Now, this is important because based on the war room's projections, the state could also see additional 400 cases in the next 1 week. Let me go across to my colleague Shrija, who's joining me live with those updates. Shrija, good morning. We did see some time back that the number of cases in the state of Karnataka had come down, and that was, of course, a sign of relief. But this is important because right now we are looking at a rise in the number of cases in the last 4 days. Projections also say that perhaps there could be a rise in the next 1 week, possibly after lockdown. What is the reason for the sudden increase in the number of cases?
Well, good morning, Apurva. In fact, we see that the health ministry here in the state had initially predicted, this is in the beginning of April, where we would touch nearly 1,000 cases at least by the end of April. But however, we still stand at nearly 523 cases, which means so far 207 discharges have taken place so far, which means we are talking about a recovery rate which stands nearly at 25.2%. Yes, of course, we are still way behind Kerala, where we are talking about where they have remarkably touched nearly 72.3%. This is a recovery rate, and we're talking about a neighboring state, Tamil Nadu, as well, which is about 56.8%. So if you're really comparing, yes, of course, Karnataka as a state is still way behind the neighboring states, but if you're really talking about the national average, we're really doing well. But the word which is coming in from the COVID-19 war room, what we understand is that including some of the top medical experts in the COVID task force, what they tell us is that once the lockdown is lifted, this they are predicting right after May 3rd, we are going to witness a huge spurt in cases. We are looking at a huge spike in cases as far as coronavirus is concerned in the state of Karnataka. The only reason this projection was made because over the last 7 days, if you're really looking at 106 cases have been reported just in one particular week. Now, this is a huge spike as far as Karnataka is concerned if you're really taking the graph over the last 2 to 3 weeks. So if you're comparing it with that, this week has been really the highest, and based on that projection, we understand they have predicted that next couple of days, or at least another next 10 days, is going to be very crucial for Karnataka, also considering the fact that, remember, once, if at all, the lockdown is lifted. Now, remember, very recently we saw how all the states, the chief ministers had a talk. In fact, there was a video conferencing with Prime Minister Narendra Modi, but however, we see a decision on that, even though other states did in fact put out their request as far as the extension of lockdown is concerned, but there is nothing of that sort which is being taken. But the latest what we are picking up from the Karnataka government is that at least over 10 districts have in fact relaxed as far as lockdown is concerned. Of course, they will be analyzed, the situation will be analyzed. Depending on that, we understand there will be, of course, a staggered exit as far as the lockdown in the state of Karnataka is concerned. Back to you.
All right, Shrija, many thanks for joining us and bringing us all those updates there from the state of Karnataka.